Hello, I'm Dr. Maury Markman from City of Hope, and I wanted to continue briefly the conversation we were having about both the history of the current situation and the future of precision cancer medicine. And when I refer to the future, I'm really making this really a high-level point to say we have now so much information about precision cancer medicine. Targeted therapeutics have become the standard of care in so many tumor types. We are now at a point where we are replacing a standard of care targeted therapeutic with a more effective targeted therapeutic. That's how the evolution has occurred and will continue. It's the process, of course, of precision cancer medicine. We're always trying to be more precise with our effectiveness on the one hand, and critically, our toxicity on the other. And I refer just for one example of that phenomena to an abstract presented at ASCO, very specifically at the annual meeting, looking at update. This data had already been known, but this was an update of patients who were ALK positive, non-small cell lung cancer, who were treated with the third generation ALK tyrosine kinase inhibitor, erlotinib. And this was a randomized phase 3 trial compared to the first generation drug, which changed the standard of care in that particular entity, making knowledge of whether the patient had an ALK mutation, ALK rearrangement critical. This was comparing to crizotinib. And with a median follow-up of now of 5 years for the trial population, the median progression-free survival for patients treated with lorlatinib had not been reached, compared to 9.1 months for patients treated with crizotinib, with a hazard ratio, unbelievable, 0.19. So that is the equivalent of well over 80%, actually 89% improvement in progression-free survival. The 5-year progression-free survival overall for the new agent was 60% versus 8% for crizotinib. Again, the remarkable statement is, I'm talking about 5-year progression-free survival with ALK positive advanced non-small cell lung cancer of 60%. This is where we are, and we will only continue to progress in the future with this concept of precision cancer medicine. And I thank you for your attention.